Viagra, Cialis, Levitra. Should you be on these medications? Yes, you should, if you're safe for it. Let's talk about it. Hey guys, Dr. Segel here. So the question is, everybody talks about how awesome Viagra is. Should I be on it? And at the end, we'll talk about, so we'll go through all these different medications. At the end, we'll talk about kind of why one of these medications is sort of a magic bullet treatment to not just treat erections, but treat something else. So stay tuned at the end to kind of learn about that for sure. So what I tell guys, I always feel like, it's our job as doctors to empower the patient. So if somebody's on the fence about it and they really feel like this has an ability to improve their quality of life, yes, they should be on it. Because if it's important to you, then by all means you should consider it. But let's go through kind of each one of these medications in a little bit of detail. Let's talk about kind of the evolution of some of these medications as well. So one of the things that I love about these medications is that they've become generic. I've been in practice 10 years now and was prescribing these medications before that in training. And it was very frustrating when the medications were not generic because they were super expensive for people. We were figuring out what different ways we could ration them for people so they could get as much bang for their buck. We'd write for a higher dosage, have them cut it in half, all those sorts of things. We still do battle with insurance companies about kind of getting a lower cost for people. That still exists, but they are way cheaper than they used to be. So that's one of the kind of feathers in the cap of these medications. They're called PDE5 inhibitors, okay? Why are these medications great for erectile dysfunction? They're relatively easy, they're common, PCPs feel comfortable writing for them, they're super discreet, the onset of action is pretty darn quick. And when I say discreet, it means you can pop the pill, the person doesn't know that you even took it, and boom, you're getting an erection. It does require sexual stimulation for sure, but that discretion of it is fabulous with these medications. Let's talk about, the three kind of big three medications in this drug class. They're tadalafil, sildenafil, and vardenafil. Okay, tadalafil is also known as Cialis. Sildenafil is known as Viagra. Vardenafil is known as Levitra. The first thing I want to kind of talk to you about the reasons why you shouldn't be on these medications, right? These medications have the ability, remember the way that they work is that they open the blood vessels to the penis, allow blood flow to get better into the penis, and when those blood vessels are dilated, it actually presses on other blood vessels to prevent blood from leaving to the penis. So it kind of works in a dual fashion in that regard. But to that end, when you dilate blood vessels with these medications, you don't want to dilate them with other medications, right? So nitrates. So individuals that may take this for a cardiac condition, if you take a nitrate with these medications, then it can cause an unsafe drop in your blood pressure because it's dilating your blood vessels too much in your body. Not enough blood can get to the heart and you can get a heart attack. So that's super important to know that. That's probably the biggest, what we call contraindication or reason not to be on Viagra, Cialis, Levitra. Alpha blockers. So sometimes people take these medications for lowering their blood pressure. And if you pair that with Viagra, Cialis, Levitra, it can drop your blood pressure too much. Medications like Flomax, which individuals might take for their prostate, it'll open up kind of the smooth muscle, relax the smooth muscle of the prostate, and it can drop your blood pressure. So you don't want to be on these types of medications, the erectile dysfunction medications, if you're on Flomax, if you take them simultaneously. Oftentimes I'll tell people, if you're going to take them, that's okay, just space it out about 4 hours. So that's a tip with Flomax and these medications. Grapefruit juice, a lot of medications, the concentration in the serum or in the blood will go up when you take grapefruit or grapefruit juice. So that's something to be cognizant of, to hold grapefruit juice or grapefruit. Also, this is a big deal. So when I prescribe these medications, I tell my patients, if you get an erection greater than 4 hours, go to the hospital, okay? We have a whole video on that, something called priapism. Check that out if you're curious about it. Guys, if you get an erection greater than 4 hours, don't jump up and down. Don't be excited. That's an emergency. Go to the hospital. So that's important to get that taken care of. The three medications, tadalafil, Cialis, it can be effective for up to 36 hours. So it's the longest acting one drug in this class, and you want to take it about 30 to 60 minutes before you want to generate an erection. Sildenafil, Viagra, 30 to 60 minutes again before you want to have an erection. It works for about 4 to 5 hours. Vardenafil, Levitra, works about 8 hours, again, 30 to 60 minutes before you want to have an erection. Okay, that's the tidbit of information with that medication. They all have very similar side effects. Now, I do think that individuals will have a higher side effect profile with one versus the other. There may not be much difference in how well they work from one to the other, but some people will say, doc, every time you put me on sildenafil, I'll get these visual changes. Whereas they say, when I'm on Cialis, I don't feel that, and vice versa. These can be interchanged between all these medications. But I want to list them just so if you're on the medication and you start experiencing one of these things, you can maybe blame it on these erectile dysfunction medications. Low blood pressure. What goes along with that is dizziness, flushing, back pain, stuffy nose, headache, nausea, changes in vision, prolonged erection, which we talked about. So those are some of the more common side effects. Most guys, frankly, do pretty darn good with it and don't have an issue with those side effects. But if they're going to have side effects, it tends to be one of those. Another use for these medications, which I love, especially in younger guys, is it helps with what I call psychogenic erectile dysfunction. So psychogenic just means kind of, I don't mean to say it's all in your head, but I think people psych themselves into trying to get an erection, and it helps them not get an erection. So when you want to generate an erection, we have this kind of point and shoot acronym in urology. To generate the erection, you have to have the P part of, meaning your parasympathetic nervous system kicking into high gear. That is the relaxing part of your nervous system. You want to be totally relaxed, and that helps you generate a reaction. Ejaculation requires the sympathetic nervous system, the shoot part of it, right? It's the S, shoot, sympathetic. So you don't want that sympathetic system in overdrive when you're trying to generate an erection. The sympathetic nervous system is kind of the fight or flight response. When you're on edge, you're going to have an overdrive of the sympathetic nervous system. If you have too much of that, you're not going to get an erection. So we want to kind of play up the parasympathetic system. We want you to be relaxed. What happens oftentimes in guys, especially younger guys, I see this all the time, is for whatever reason, they can't get an erection, right, when they want to perform. And when they can't get that erection, then the next time they want to get an erection, they already have it in their brain. Oh my gosh, I'm worried about it. I know that it's not going to happen. And boom, they are so stressed, there's no way they're going to get an erection. So the sympathetic nervous system is in overdrive. It is making them feel like they're doomed to get an erection, and they're not going to get an erection in that situation. So sometimes I'll prescribe these medications for an individual and just tell them to put it by their bedside. And when it sits by their bedside, just the fact that they have it makes them be able to relax. When they relax, the parasympathetic nervous system, the relaxing part of the nervous system, goes back into overdrive, boom, they get erection. So that's another use of the medication, simply as kind of an insurance policy. It's the same thing as individuals that have difficulty sleeping. Sometimes if they have a medication that helps them sleep and they just put it by the bedside and they know that it's there, all of a sudden they can relax and sleep. So it's the same idea with erectile dysfunction. One other thing that is important, sexual activity, it can be a strenuous activity. Make sure you're safe for sex with your primary care doctor. And then finally, I want to kind of give you my pearl of wisdom for what can be considered like a magic bullet treatment. So Cialis in a 5 milligram dose, and you may or may not have heard this, can work in two ways. First of all, by the mechanisms that we just described, dilating the blood vessels in the penis, it can help you get an erection. And it's a long-lasting medication as well. So sometimes I'll tell guys to take Cialis 5 milligrams once a day, okay? So it helps them generate a spontaneous erection because it's always a little bit in their system. It works by increasing the concentration of cGMP. which is a molecule called cyclic guanosine monophosphate. And when that serum concentration or blood concentration goes higher, it relaxes the smooth muscle in the prostate as well and helps them sometimes pee better. So it's a magic bullet treatment in that it's both working on your erections on a daily basis and helping you kind of pee better, generate a better stream, help with urgency, frequency, etc. So sometimes with guys that have mild erectile dysfunction and they have some urinating issues, we'll put them on a daily Cialis as a magic bullet treatment. It's treating both the urinating issues simultaneously as treating the erection. So that's my kind of tidbit of information I want to impart upon you all at the end. Thank you so much for listening. We certainly appreciate it. Please subscribe to our channel. We put out at least 2 new videos a week. We appreciate it. Thank you. Have a great day, y'all.